what's the difference between a Medicare Advantage plan and a Medicare Supplement plan? That is such a great answer, and it's a loaded answer too. So if you're taking notes, that is a great thing. Again, if you don't know me, my name is Melissa D. Hall, and I'm the owner of the Hall Insurance Group, and I have been in the Medicare industry since 2017, okay? So let's start off with a Medicare supplement plan. A Medicare supplement plan, right, covers all of your Medicare expenses, especially if you get a Plan G. It covers the full 20% that Medicare doesn't cover. All right. You don't need a referral to go to a doctor. You don't have to pay any co-pays. Only thing you do have to pay is Part B deductible. All right. I think right now it's about $264. It changes every year. So depending on when you're looking at this, it may have gone up, or if we're lucky, may even down. Right. So with the Medicare supplement plans, it's a Plan A through Plan N. No matter what company you go to, it is the same benefits. Okay. And again, they cover all your bills. You can go get a second opinion. If you want to go to a specialist, if you've had a surgery, if you have a hospital stay, you don't have to pay anything. You just have to pay a monthly premium. So that's the thing. There is a monthly premium attached, guaranteed to the Medicare supplement plan. Also with that monthly premium, it can go up. Okay. So that's the thing. So your monthly premium for a Medigap plan, let's say when you're turning 65, all right, it can start off at $10 a month, right? But by the time you're 75, it could be over $200 a month and go up from there. However, if you need a lot of care, it's a good thing to have, because let's say if you had knee surgery, that's a very common surgery, and you need rehab 3 times a week for 3 months, okay? And if you're on a regular, let's say a Medicare Advantage plan, and your copay is $40 every time you go to a specialist, that's $120 a week. However, if you're on a Medicare supplement plan, that could just be your monthly premium, and that's it, right? So now, thing with the Medicare supplements is this: it does not come with the Part D plan. That's the drugs, right? D stands for drugs. All right, that's funny to me. But anyway, D stands for drugs. So it does not come with the drug plan already built in, so you have purchased that separately. Also, usually with the Medicare Advantage plans, they usually have the extra benefits such as the silver sneakers or some type of fitness plan, the dental, the vision, those types of things. So another feature that the Medicare supplement plans have is that you can actually switch them all year round, okay? So for instance, let's say your premium does increase on your Medicare supplement plan. Okay, well, you can go ahead if you health qualify, because that's the thing. You do have to health qualify once your initial enrollment period is up. So that year is up. Okay, so you have to health qualify to get into another plan. Okay, so as long as you health qualify, you can get into another Medicare supplement plan year round. This varies greatly from a Medicare Advantage plan, which you can kind of only change during the annual enrollment period, or if you qualify for some of their special election periods, okay? Now, let's talk about a Medicare Advantage. So, Medicare Advantage plans, first of all, these are issued by private companies contracted by Medicare, okay, to go ahead and administer care to Medicare beneficiaries. Let me tell you why the government did this. Currently, there are over 40 million people on Medicare, okay? 10,000 people a day turn 65. Listen, our government does a lot of great things, but when it comes to healthcare, they are definitely overwhelmed. So they instituted these companies, they hired them like your Aetnas, your Humanas, your Blue Crosses, okay, to make these Medicare Advantage plans to make sure that our Medicare beneficiaries were able to receive the healthcare that they deserve. The great thing about these Medicare Advantage plans is that no matter what's going on with your health, you're able to get into one. So let's say, unlike the Medicare supplement plan. If you've been on Medicare 2-3 years, you will have to help qualify. If you've had something like a knee replacement or a few heart attacks, cancer, it's a very slim to none chance that a Medicare supplement plan would accept you. However, with the Medicare Advantage plan, they'll accept you, okay? No questions asked, which I think is amazing. Now, this is the thing with the Medicare Advantage plans, there could be what we call a network. So meaning that you can only go to providers that are contracted with that plan, okay? Now, if you try to go outside of that, plan could have you pay out of pocket, right? Or you would have to pay a higher rate out of pocket. So that is something, unless it's emergency care. All right. One of the benefits about the Medicare Advantage plans is that they are usually no cost or low cost. So that is great, especially if you have some budgetary concerns. And of course, it wouldn't be an advantage if there wasn't an advantage, right? So they usually come with extra benefits that Medicare usually doesn't cover, like dental, vision. I know I spoke about silver sneaker plans, all types of things, home health care, which is huge, and just a plethora of benefits, over the counter, all types of things. Also, I know some of you out there may see those commercials that talk about putting money and stuff back into your check. Well, that right there is usually done through a Medicare Advantage plan.